Good afternoon, everybody, and welcome to our plated skin science webinar. My name is Shane Rorrer. I am the skincare specialist and makeup artist for the Parker Skin and Aesthetic Clinic. I'm a cosmetology license holder for the past 10 years, as well as a freelance makeup business owner for the past 12 years. I've also worked in Aveda salons and schools for about half a decade, learning a lot of education there. And I'm also a participant as a makeup artist in New York Fashion Week. So I've been exposed to a lot of different types of aesthetic beauty industries. And then joining me today is my co-host, is Jessica.
Thank you so much for having me. Hi, I'm Jessica Joseph. I'm the plated skin science rep for Michigan and Northern Ohio. I've been in the aesthetic industry for over 8 years, and I've worked for a variety of different unique technologies and companies. And I'm definitely passionate about helping people achieve their anti-aging goals. And Plated is one of my most favorite products and one of the best companies I've ever worked for.
So this product is new to the Parker Clinic, and let's get into it. So we are carrying 2 serums by Plated, both the Intense and Daily. The Intense comes in half of an ounce, and the Daily comes in 1 fluid ounce. We've been retailing this, I would say, what was that? Was it early January or late December?
Yeah, late December.
It's so new to us. I just now have had like 2 different patients at the top of my mind replenish their bottles. And I'm gonna tell Dr. Parker, she's on her 3rd bottle right now and she loves it.
Yeah.
So why is Plated so revolutionary right now? This is using human-derived platelets. I'm so sorry. This is using human platelets, which is the body's first responder to healing. Can you lead on up that a little bit?
Sure, yeah. So platelets are kind of like not platelets, exosomes are the it product for 2024. As Shane was starting to say, ours are human platelet derived. And so as you'll learn a little bit later, even hearing from Dr. Parker, so sourcing is super important in exosomes. And so we actually source ours from US blood banks that are FDA compliant. And what that means is that they're platelets that are ready for FDA or transfusion grade. And in certain states, every state varies, they're viable for transfusion for like 5 to 7 days. And the reason I'm mentioning that is because we want everyone to know that we're not taking them from blood banks or anything like that. After the expiration time that they're viable for transfusion, blood banks have to pay to dispose of them. So we're actually purchasing them, and then they come to us already rigorously tested to be FDA transfusion grade. And then we then test them in our proprietary manufacturing process. And we have a patented way to isolate the specific platelets that we would like and the specific exosomes. So we focus on regenerative exosomes only. And platelets are very abundant and plentiful. And the unique thing about our product is that it's shelf stable. So we're able to produce like a shelf stable serum that you can use topically, or you can use it with post procedure. So you don't have to have a laser treatment per se before you get this exosome treatment. You can actually do a take-home treatment on your own in conjunction with your existing skincare. But Shane, did you want to chat a little bit about what exosomes are?
Yeah, let's talk about exosomes for a minute. Most of us probably do not know this word exosomes, but these are little messaging cells that deliver another message to another target cell. So at the bottom of the screen, I almost like to think of it as a letter inside of a protected envelope that's carrying that message. We send the letter off through the postal service, and then it is received, which, the receiver opens it and it has information in it. So, and let's also talk about platelets for a minute, because again, those platelets, it's the body's first responders when we are wounded. So they're taking those information exomes from the platelets and they're putting this in topical skincare. And I think this is really revolutionary because on my standpoint in the clinic, I'm seeing healing happening a lot quicker with patients, seeing reduced redness downtime. People are telling me that they're actually able to get to their social functions quicker, especially those after a laser procedure. So as we age, we know our cell cycle kind of ramps down. Things, they do not duplicate as quick. So it's almost like every decade of life, we are slowly working backwards with our US postal system, if you want to think of it visually that way. They started out with like, horse and buggy, things were not nearly as fast. Now we have planes and all of those things, where these days they have like the latest equipment and all of their mail carrier systems. So we want to think of this visually like this is that like 21-year-old state of skin that we all used to have. And then again, with every decade, it's just not as fast. So by using topical exosomes, I am seeing it ramp the skin back up, almost back to that youthful state. Almost, and I've noticed this almost in every decade of age with patients using it. I'm talking 30s to 80-year-olds. And I think that's pretty significant, the fact that like that big frame of decades, like my grandmother was surprised.
Yeah, I think that's a good point. So this is a product that anyone can use. As Shane mentioned, like as we're aging, we're losing those regenerative exosomes. I think one important thing that we talk about sometimes too is just like as the body loses collagen, we actually naturally occurring in our body have regenerative exosomes. Like all of our cells have exosomes, and so as we're aging, the good exosomes are declining as well. So to your point, it's like we have to kind of get back to that youthful state, and this product is adaptive. So we'll kind of dig in and show some before and afters, but depending on what your issues are, your skin concerns, it can target things like photo damage, redness, fine lines and wrinkles. So even a younger patient type that maybe is just starting their anti-aging journey, they really love this product for the overall like luminosity that it provides to the skin and just radiance to the skin as well. So it's really kind of like a great product for everyone in that journey. It doesn't really matter if you are, as you mentioned, like starting off with a laser, or if you just want to add it to your current skincare routine. It's definitely a versatile product, and it's the newest technology that's out there as well.
I will say I have had some guests use it without a laser procedure or without any treatment, and they are noticing very nice results too. So you do not have to have a procedure or treatment in order to use this product, but it will definitely help that treatment heal quicker.
For sure.
So let's talk about some good and bad messages. Like as we age, we can get accumulation of bad messages going on, like inflammation or degradation. But we know, good skin, good messages, make elastin and repair collagen. And there's so many ways to repair collagen these days through aesthetic services, but it can be a little bit harder to target elastin, especially through applying topical products. And I can say the plated products are helping target more elastin production, not just collagen. And we know that is, so pivotal, just like collagen or skin. If we don't have equal parts, our mattress may not be as firm. We might have a dilapidated mattress, which nobody wants to sleep on that. So let's look at some before and afters, and these are from Plated. These are not our patients, but these are from Plated. And I thought this was pretty incredible. Like, I mean, all my patients love this slide.
Yeah, it's great tone and texture and luminosity to the hand, and even really looks like a lot of hydration as well.
And I wish I had the age of that patient, but I do not.
That patient is in their 60s.
Oh, wow.
Yeah.
I mean, that's a pretty incredible. And then this is 6 weeks of use, and we're focusing on that orbital eye area.
Yeah.
And I think that's pretty incredible for 6 weeks, because a lot of times when I see like eye cream data and things like that, it's usually at like 8 and 12 weeks. And, this is a multifunctional serum that's also targeting these crow's feet lines.
Yeah.
So I think it's amazing.
And this patient is 61. She was in our trial, and this is topical use only. So to your point, there's a lot of topicals out there that help, but like just to have this great reduction in the fine lines is incredible at 6 weeks.
I think that's amazing. Then here's a gentleman, because, guys need good skin too. We can definitely see his redness has cleared up a lot. Even some of his brown spots are much lighter, and that's in 6 weeks. I think that's pretty amazing.
Yeah.
This one is very impactful. You can see that her redness has calmed down. I think that is absolutely, and that I will say that's something I noticed in my skin, being in that 20s to 30 age category. I deal with a lot of redness in my skin from post acne, so this was very pivotal for me in reducing redness.
And again, that's at 6 weeks, to your point. So we love seeing that. And sometimes patients, when they're on their journey, like you can see the reduction in redness, and now she might want to target other skin concerns, whereas before with all of the redness kind of camouflaging that, like she's a great candidate for a laser as well now. And so sometimes using these products can really get your skin to a great condition to then move forward with another treatment or procedure to continue just enhancing your goals that way.
Yeah, because with that amount of redness, a lot of times that is targeted through lasers, but the fact that that was targeted with a topical product, I was very excited. And then this is after a laser procedure, from my understanding.
Yeah, it's a CO2.
So we can see it definitely sped up. Well, at least visually for me, like between after 2 days, after 4 days, and at 7 days, to me, it looks like her skin has definitely healed much quicker. It definitely seeing lumosity. I'm not seeing as much of that, like, that after scabbing of laser while we're healing.
For sure. Yeah. And patients in this trial for post CO2 did report like less pain and tenderness. We kind of talked about that, which is always super important because I feel like sometimes the downtime that's associated with some of these lasers is just not fun.
And it's interesting you brought that up because I have some tretinoin users, which is a topical prescription, that does have some side effects sometimes of, shedding, flaking, and sometimes sensitivity. Those users that were having sensitivity with tretinoin, when they started using Playita, they actually were not sensitive to their tretinoin anymore, which I thought was pretty incredible. So now we're going to hear a testimonial from Dr. Parker and her personal use of
So
Playita.
this is the first exosome product that I was personally willing to try. True exosomes, which are human platelet-derived exosomes, should be the most effective. We have to be careful that they're properly sourced. This product comes out of Mayo Clinic, and so I felt confident. I liked it as a hyaluronic acid serum with so many exosomes in it. I tried both the intense and the daily.
Which one did you use first, if I may ask?
So in my mind, first using the intense, and then once that bottle's gone, switching to the daily is a good way to go. And I actually started using it after I had a little skin beef procedure. So I was needled a bit and, and that sort of thing. So I think the two in combination were wonderful. But after I started using the product, I definitely noticed that my skin had more of a glow to it, is sort of the best way I can describe it. And people actually asked me what I had done, what procedure I had done. Well, beyond, people were asking, what did you do to your skin? Like, even people who worked here noticed that something was different, something was better. So I know it's working. Yes.
Are you using this twice a day or once a day when you're using it?
So I actually used it twice a day.
Okay, I'm seeing most progressive results that way.
I liked using it twice a day in the beginning. I really did. My skin bead procedure was actually not on my face. It was on my neck and décolleté.
Okay.
It was, my face, I was doing nothing different other than using a plated product. It's the only thing that changed was that little addition to my skincare routine, which made a difference that people noticed, including myself. I have snuck a bit onto my neck and décolleté, and I've snuck a bit onto my hands to, keep the rejuvenation going.
Well, we know you have glowing, radiant, amazing skin as always, but I can say, seeing you day to day, I've noticed a slight improvement in lumosity of your skin, the glow.
Thank you. There
really is.
It's hard to describe, and I don't think it's often that we see a change that quickly in our skin.
And that's the comment I'm hearing from patients healing from their treatments, or even if just at their baseline, they're noticing results visually pretty quick.
Yes, and exosomes should help with healing. And Mayo Clinic is using this product in the cardiology department, and it has a lot of medical uses, but it is regenerative and it is healing. And so it's actually a great product to use post-procedure or anywhere you need a little extra recovery. Exosomes are certainly, I think, a big part of the future. They can be controversial in the sense that we do need to be careful about where our exosomes come from.
So not all exosomes are created or sourced equally?
Not at all. Not at all. So we need to be careful about that. There are exosome products out there that are not FDA approved, not FDA cleared. And we are sticking with the product that is, we know, well sourced and approved.
Well, it's amazing. I'm looking forward to seeing the other skin journeys as they continue to use Playita.
Thank you so much, Shane.
Thank you, Dr. Parker. thank you, Dr. Parker, for her personal testimony. I can say I've seen a lot of changes in her skin since she's used it.
Yeah, I love what she shared about luminosity. Sometimes that's something that like you don't notice when you're looking at yourself every single day, but other people notice that. And improvement in like overall color evenness is something
Well, I'll say
also.
as a makeup artist, like usually when someone comes to me and they know I'm a makeup artist and they want luminosity, they're looking for like a highlighter pigment. They're looking for a makeup cosmetic, and this is true skincare that is actually making the tissue actually glow. So I like that this is true skincare, and we're actually achieving it from a non-makeup standpoint.
Yeah.
So let's talk about how and when to use plated. We kind of touched on this, but of course, on freshly cleansed skin, you should never apply your topical products to dirty skin. That's just a no-no. So first, apply plated. And from my understanding at the manufacturers, they recommend waiting 10 minutes post-application for max benefits.
Mhm.
Can we talk about that a
Yeah,
little bit?
so we just especially if you're going to layer with other skincare products. So you can use plated topically as a one and done, kind of standalone anti-aging if you're just beginning your journey. But most of us have quite a very diverse regimen of products we like to use. And so there's,
Guilty.
right, exactly. And like you mentioned how patients that maybe are using like a retinol or tretinoin, sometimes starting these products to prep the skin or prime the skin before using a more aggressive, active, or even prior to getting an injectable or laser treatment. It's very helpful. So to your point, if you're using it in combination with anything, you want to just wait 5 or 10 minutes for the product to fully absorb and dry before you layer any additional products. And it's totally safe to use plated first and then add layer of vitamin C in the morning or retinol at night. It's just gonna enhance and boost those results. It's not gonna in any way counteract them.
And as Dr. Parker said, you can apply all over. She likes it, on neck and décolletage. She even puts some on her hands. But she is using it twice a day for max application. And most of the patients I have spoke to, they are using it twice a day. So I feel like they are getting max results that way.
For sure.
And of course, consistency is key. If you're using this one day a week, we're not going to get enough nutrients from that product to really see a difference. So consistency is key there.
And I think most people are going to use 1 to 2 bottles of Intense before they migrate to the daily being a maintenance. So that's another good way to look at it too.
Yeah, and let's talk about that too.
Sure,
Of
yeah.
why would we start with
We're gonna
Intense
talk about
versus
that now.
daily? Yeah, let's talk
Okay.
about that.
So we also have this really awesome bottle that has a refillable cartridge. And so it's definitely more sustainable. There's less plastic, and we're definitely meeting that recyclable initiative. Exactly. So you can purchase these separately after you've done your first bottle. You want to keep your first main cartridge here with the pump. And we like to do Intense typically if someone has fine lines and wrinkles, photo damage, underlying redness. You're going to want to do 1 to 2 bottles of Intense, and sometimes even up to 3 really.
Okay.
It's going to be provider recommended. And some people, quite honestly, they'll never give it up. So that's
I
okay
think
too.
I'll stay on the intensive personally.
Yeah. And then after that, you can move to the daily. So the daily is a little less concentrated. Maybe we should just chat briefly about that too. So
Yes,
in terms of exosome
there are more
content,
exomes per pump of the intensive.
right. So all the bottles have over 1 trillion exosomes. Intense has 15 billion exosomes per pump. And then daily has 7.5 billion exosomes per pump. So daily is more of your maintenance, or potentially if you're just kind of starting out your skincare journey and you still have very youthful skin and you haven't really lost a lot of collagen and elastin yet, you can actually just start with the daily once a day as well. So really just kind of customizable based on where you're at in the anti-aging process. But most patients will do a couple rounds of Intense and move to daily as a maintenance.
I say so far we've had most patients start on Intense. Most of them have actually done a second bottle of Intense, and that's where they're at right now.
Yeah.
So I'm, still looking forward to seeing some of the daily results for maintenance. But as Jessica said, if you don't have this big plateau or big, sunburn that happens or something,
Right.
we in theory could use the daily after the intensive.
Yeah. And some of your patients that are regularly staying up with their treatments, and they're, getting consistent lasers and different facial treatments in addition to their injectables and things like that, their skin might be in really great condition after, and using medical grade skincare and sunscreen and all of that. So they could actually potentially just start with a daily. I mean, if you really don't have an issue with photo damage or underlying redness,
and that might be somebody in their 20s potentially, depending on how exposed their skin has been.
For sure. And you get a lot of great luminosity with that product as well.
We really do. Well, let's go to Q&A if we have any questions. So I'm not seeing any questions in the chat right now, but I do want to mention that the retail cost for this product in our clinic currently is $267. And this month for February, we are having this on special for 20% off, or sorry, no, I think 25% off actually. Ooh, better deal. So that brings it down to $200.25. So this is a great time to try it, whether you're not sure if you want it, but this is a great introductory deal. And I'm happy to sit down with you and discuss more about how this can be worked into your own personal regimen. I'm always here for help for our patients. Well, thank you guys so much for joining us on your lunch break today. Jessica, thank you for coming all the way to our clinic for this webinar today.
Thank you for having me.
I appreciate all your support.
Of course.
All right. Well, thank you guys.
Thank you.